This is breaking news.
It is finally here. The first doses of the Pfizer COVID vaccine have arrived at Northwell Health. Two frontline workers have volunteered to be the first to get the vaccine in New York State, and that is happening right now at Long Island Jewish Medical Center in Queens. Let's go to that live.
Even though while we have the vaccine and we're going to be vaccinating our staffs over the next period, and then obviously the public, that all during this time we still have to make sure that people do all of the preventive things that they need to do, which is wear a mask, social distance, wash hands, etc. Just because the vaccine is here is no excuse to lay off all of the other things. Got to go both. And if we do both, we will eventually, within a relatively short period of time, we hope, come to the end of this pandemic. So we will be doing another vaccination in a few minutes, and so you can observe what that is like. But at the moment, let me ask our Chief Quality Officer in the health system to come up and say a few words. That's Dr. Mark Jarrett.
Thank you, Michael, and good morning to everybody who's here. I first of all want to thank our healthcare workers and the team members at Northwell who are not only getting vaccinated this morning, but for everything they do every day in trying to help people. They truly are the heroes, and it's really great. I think this is a wonderful turning of the page and actually to a whole new chapter in our dealing with COVID. I would just ask everybody to remember this is about science. There's been a lot of preparation for this, and we've had a lot of eyes on all of the studies, and we all feel comfortable that this is exactly the right thing to do. This is the only way we can return to a normal society, a society where people can visit family and friends, a society where people can go to work, where our economy can be restored, all those things only through this way. But most importantly, a society where not only ourselves, but our family and friends are protected. And that is the most essential thing. So again, we look forward to not only vaccinating our members this morning, but continuing this over the next 4 to 6 weeks, depending on the supply, the 4 to 6 weeks to complete all of our healthcare workers who put their lives on the line every single day of the week. Thank you.
You know, going through this process requires working with a lot of people in partnership. And I would just like to say welcome to Maria Castaneda from 1199, who is in the room. Thank you for being here. Thank you for the support and your leadership, etc. Thank you. So a little bit earlier, we vaccinated the first individual, Sandra Lindsay. And Sandra will come up in a little bit and say a few words. But let me show you in a very, very brief video, her getting the vaccine. So let me ask Sandra to come up and just say a few words to you.
Thank you, Mr. Dowling. Good morning, everyone. Today's a special day for me, and it should give you all hope that finally the vaccine is here. I feel like the vaccine is safe. I'm confident in the science. And this marks the beginning to an end of a very dark time in our history. So we should all feel hopeful today. My arm feels fine. It doesn't feel any different than getting a regular vaccine. I feel relieved for myself, for my colleagues who've been working tirelessly on the front lines over the past few months. And I can't thank them enough. As a leader in the health system, I think it was important for me to take the vaccine, to lead by example. And so I wouldn't ask my staff to do anything that I would not do myself. And for my minority community who is skeptical, perhaps, about taking the vaccine, I want to let them know that it's safe to take, because the alternative is dark, it's painful, it's suffering, and probably death. So I encourage you all to take the vaccine. I encourage you all to listen to the recommendations, to social distance, to not have gatherings this year so that we may gather in person next year, and practice hand hygiene and continue to wear your mask. Thank you.
And now let's move to the next person to get the vaccine is Stephanie Carl. Stephanie is right here in front, also an ICU nurse. And she will be willing to say a few words to you after she gets the vaccine. The vaccine is being administered by Dr. Michelle Chester. And as you saw in the video, she did the first one this morning with Sandra. So let's proceed with the next vaccination. Okay, congratulations, Stephanie, congrats. So you may want to tell people how you feel.
I feel great.
Oh. You have an extra mic, you'll get it.
As everyone has said before me, it is the light at the end of the tunnel, and it's hope for all of us. Because this last year has been just undeniable pain and suffering that we've never witnessed. And I'm just so grateful and happy that we're going to start to see the light, and that we're going to get through this together. We have to continue to wear our masks and stay socially distanced and wash our hands. We can do it for a little longer, and then we're going to be all together again. I can't wait. It's been a long, long, hard road.
Okay, and maybe Dr. Chester, you want to say a few words? You can come over here.
Thank you, Mr. Dowling. I just want to say this is a real proud moment, for me. To be able to do this on behalf of Northwell. And, we're in this fight together, and, asking everyone, please, number one, be patient, because it's going to come, your turn will come. And two, maintain the social distancing, wear your mask, wash your hands. It's so important. And Sandra has said it very well. Let's do what we have to do now, the correct way, so that 2021 we can all be together in a room and not just virtual. Thank you.
Thank you, Doctor. So let me ask Sandra to come up to here, please, and maybe Mark. And then if you have questions, we will take some. Thank you.
Any questions?
How have I been chosen? Working with Northwell and the vaccine being here, an opportunity came up for, the question was asked if me or anyone among my team would be willing to take the vaccine. Stephanie's part of my team, who's been working tirelessly. Thank you, Stephanie, for everything that you do, continue to do. And I've been waiting for this day, not only for myself, but to show people that it's safe. I believe in the science, and I want people who look like me, associate with me, to feel confident and comfortable in taking the vaccine.
You guys have not seen so much this year, which Europe has the worst corona outbreak in the entire world. How emotional is this moment?
Extremely emotional. I don't think it has hit me yet. I think when I go home and I watch the tape, it will really hit me. But I'm hopeful, I'm excited, I feel relieved. I feel like we're coming to the end, and we really need to put an end to this pandemic.
Can you take us back if you went to the worst period, the darkest period, and kind of put yourself in the present back there and tell us what it was like and how excited you were when that happened?
The worst period is every day hearing rapid responses, one after the other, being called. It's expanding our ICUs from 4 to 10. It is working, seeing my staff work 14, 16 hours to save lives. It's holding people's hands while they pass away. It's calling family members and doing FaceTime. It's crying with people. It's coming together and just helping each other to get through the day. It was dark, it was painful, but I believe today that, it's very hopeful, and I'm excited, and I see the light at the end of the tunnel. We're not completely there yet, but we will get there.
Are you concerned about, you mentioned skepticism perhaps in the broader community. Does that concern you, that not everyone is as eager as you are?
It does not concern me. The alternative is worse. I've seen the alternative, and it's worse.
No, I know you're not skeptical, but the people that, and it's not the whole community, obviously.
Right.
There are big parts of the community that do. Does their perhaps misplaced concern?
It does concern me, and so I am going to look in the camera to all the people and say to all the people who are skeptic about taking it, use me as an example. I would not steer my community or the public wrong. My profession is deeply rooted into the science, and I can say to you that it's safe to take the vaccine. I have seen the alternative. I do not want that for you. So I encourage you all to take the vaccine, follow the experts, and don't give up. Absolutely, it has. It's very painful. We come in every day, we're courageous, we're healthcare workers, we know why we went into this, but there is still that level of fear. There's still that level of fear among us, and so yes, it has affected me, and it has affected my team. Thank you.
Some of the logistics, how many doses do you have, how many people, initially, subsequently, how many days, what were the reports of how many days?
Sure. So right now, in terms of the number of doses, it's being varied. We haven't got all of our shipment yet. We have approximately 74,000 team members in Northwell, of whom about 54,000 are on the front lines, and of whom 12,000 or so are in the emergency rooms and the ICUs, on the very cutting edge, on the tip of the spear. What we're going to be doing is rolling this out in a very methodical way based on where people work. Is it a high prevalence area in that community? Based on their job function And that does not only include doctors and nurses, it also includes environmental workers and everybody else. The environmental worker who cleans the ICU is just as much as risk as the other people in the ICU. And it also includes age, all right, because we have some team members who are older and therefore have extra risk. So we come up with a priority matrix to use over the next 4 to 6 weeks, and hopefully we can get almost all our healthcare workers done by then, so that we can put some order in it. But I remind everybody, this is a marathon, not a sprint. We will get to everybody. We can't do everybody the same day, both on a physical basis, and also we have to spread it out. So if people do have a sore arm one day afterwards and can't come to work, we don't decimate our work staff. So we're going to spread it out in a methodical way, and hopefully within about 6 weeks have most, if not all, of our healthcare workers done. Well, we're starting it a little bit today. We haven't got most of our shipments yet. Tomorrow we'll probably start more full blast wherever we have shipments, and then Wednesday when we get more at some of our other sites, we will be, going full throttle in trying to immunize everybody. Remembering, this is not like when you get a flu shot, you can stand in line, you get a shot, you go away. People have to be socially distanced. We have to register people. We have some more information to get because we need to learn from this as much as we can. Not that we should be scared of it, but that's the proper scientific way to approach it. So we can't do as many people, for example, and one day that we would with other vaccines. However, we have plans to do this expeditiously on large scale, first starting with our healthcare workers, then going to the most vulnerable, perhaps in long-term care facilities, and eventually to the general public. I could not say because it depends on the shipments arriving on time, to be honest with you.
Sandra, you have described the moments where you are holding hands with people passing away. How many times has this occurred, and what toll did it take on you?
Well, this was predominantly my team of nurses who were holding patients' hands while they passed away, and it took a tremendous toll on them. You could see the hurt and pain in their eyes, and there is not, as the leader, there's not much that I could say except to be there for them, to support them, and to continue to serve them so that they could do their jobs.
There must have been moments of complete despair for you and your team. Can you describe those moments?
Absolutely. We were scared, but we had all the PPE that we need to go in there and courageously take care of these patients. That's why we went into healthcare. And we know that we had each other to lean on when we had moments of weakness, that we could call on each other, we could call on our leaders here and in the health system, and that they would support us.
But the moment when you go home after a day like that, there must have been horrible thoughts. It must have been terrible.
When I go home, it's reflection, looking back on what I did previously, thinking about how we could do a better job, what can we do differently, what I need to do to support my team, what does my team need. It was a lot of reflection. I had to remain numb sometimes to just push forward and do the work. Thank you.
Thank you all very much.
Thank you.
Appreciate it. Thank you.